Well, good morning and welcome to this Greater Boston Chamber event, Future of Work, Mental Health and Wellness. I'm Jim Rooney, President and CEO of the Greater Boston Chamber of Commerce. At the Chamber, we started the Future of Work series to bring greater focus to the critical topic of how our region's way of work will be temporarily or permanently transformed as we move into a post-pandemic world, albeit slowly move. During our past events, we discussed flexible work schedules, the tight labor market, and changes to commuting patterns. Today, we're convening to discuss the future of mental health and wellness in the workplace. The pandemic that started in 2020 brought with it the challenge of an overwhelming amount of mental health issues in our lives and in our companies, massive layoffs, the isolation created by work from home. Small businesses were closing, worries about our own family members, and the anxiety caused by the ongoing pandemic as we watch the daily numbers reports. As the pandemic lives on, there's so much more causing concern, pain, and grief in our world today. Political divisions, international instability, inflation, and the threat of a recession. Yesterday, we learned of the horrific shooting at a Texas elementary school that took the lives of 19 children and 2 teachers. The Chamber family sends condolences to Texas and the families everywhere that are worried about the safety of their children. I imagine parents all over this country hugged their children a little tighter last night. And today marks the second year since George Floyd's heinous murder that ignited a racial reckoning in this country. The business community continues to hold conversations about race, equity, and workplace culture. These conversations have led to workplace policy changes and are critical to supporting our Black colleagues in advancing wellness in the workplace. We are almost forced to think about horrific events throughout the day. There are reasons for anxiety all around us, and it's another reminder that we need to understand and have the best tools available to support mental health in the workplace. We're going to hear from mental health experts on the role of business leaders and the entire business community to strategically support and uplift the health of our workforce. Before we get started with our panel of experts and leaders, a few housekeeping notes. Please note that today's webinar is being recorded and will be shared on the Chamber's YouTube page. I encourage you to utilize the chat and Q&A function during today's conversation. And a big thank you to our sponsor, Blue Cross Blue Shield of Massachusetts, for their support of this Future of Work series. With Blue Cross Blue Shield support, we are able to make this important program series free to every attendee. Now I'm pleased to introduce Dr. Sandhya Rao from Blue Cross Blue Shield of Massachusetts, who will introduce our panelists.
Thank you, Jim, and thank you for organizing this important work, this session and the series, and thanks for your thoughtful comments. I'm very grateful to be here with you today. As you know, for years preceding this pandemic, Blue Cross Blue Shield of Massachusetts has had a strong commitment to mental health and has been an innovator at the state and national level. But for the reasons you mentioned, these are really unprecedented times, and individuals and families are facing so many new sources of stress, anxiety, and worry. And as a plan, we want to provide confidential and convenient support, tools, services to help manage those stressors, build resilience, and improve emotional well-being as we all go through these times. We also share the concerns about the critical shortage nationwide of mental health providers. As part of this healthcare community, we are hoping to act in a spirit of shared responsibility to fix this problem and increase access to mental health services across the state. We also have a responsibility and opportunity to convene and encourage conversations about mental health, which is why we're here today. And as such, it's my pleasure to introduce today's panel. First, we are thrilled to have Dr. Tracy Mullair, staff psychiatrist at McLean Southeast Adolescent Services and a member of our own Physician Psychologist Review Unit at Blue Cross. Dr. Mullair is a double-boarded psychiatrist with nearly 20 years of clinical experience with an expertise with children and adolescents. Welcome, Tracy.
Thanks, I'm so happy to be here.
Next, joining us from ThriveWorks, I'm happy to welcome Ryan Culkin, Chief Counseling Officer. Hi, Ryan. At
How's it
ThriveWorks,
going? Good to be here.
Ryan oversees the operations and clinical excellence of all mental health services. Ryan is passionate about equipping clinicians with the skills needed to be successful as the field continues to modernize and evolve. Thank you for being here with us, Ryan. Also joining us is Ryan Morin, Director of Total Rewards for Boston Beer Company. Ryan and his team are responsible for designing and managing an engaging compensation and benefit program for Boston Beer Works' 2,700 coworkers. Prior to his time at Boston Beer Works, Boston Beer Company, Ryan worked in the financial services industry, focusing on building and managing compensation programs for wealth investment businesses. Glad to have you with us, Ryan.
Thanks so much. Happy to be here. Good morning.
Good morning. And last but not least, leading today's conversation is Nainiqua Blanding, public health leader. Nainiqua has dedicated the entirety of her professional career towards working at the intersection of health and social justice. Ms. Blanding possesses over 17 years of experience in academia, healthcare, nonprofit, and local health department settings, including previous roles at Health Resources in Action and the Boston Foundation. We're honored to have all of you here today, and I'm looking forward to this conversation. And with that, I will turn it over to you to get us started, Nainiqua.
Thank you, Dr. Rowe. It's a pleasure to be here. And thank you to all of you who have joined. Thank you to the Greater Boston Chamber of Commerce for hosting this event and for having us. I'd like to start off the discussion with building a shared understanding of what we mean by mental health. The World Health Organization defines mental health as a state of well-being. It's in which an individual realizes their own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to their community. So I'd like to first start with Tracy. I'd like to turn to you, if you can, to expound on that definition. If you can share for us, what do we mean when we say mental health, and when might a person seek behavioral health care?
Sure. Thank you so much, Nainiqua. And as I said, I'm so delighted to be here to talk about health and wellness during Mental Health Awareness Month. And I think mental health has been brought to the forefront during the pandemic. It has become universal. I think when we talk about mental health, we're talking about wellness, which includes physical and emotional wellness. So mental health is health, and I think it highlights the importance of why healthcare needs to include a strong behavioral health component to foster wellness for our employees. And I know, as our moderators introduced, that this is a time of unprecedented stress during the pandemic, where so many are vulnerable, coping with issues related to caregiving, related to return to the workforce. There's so many things on our radar which can make us vulnerable that it just is fundamental that we are promoting wellness.
Thank you so much, Tracy. And now I'd like to further expand on that. Ryan Culkin, if I can turn to you, and this is a question for all of the panelists, but I'd like to start with Ryan. If you could share, why is mental health a pressing concern for employers and the business community? We've heard from both Jim Rooney and now Tracy, the case for why we should, as a whole, really care for mental health. But can you share from a business perspective why this issue is important?
Yeah, for sure. We're seeing a lot of data around the more mental health support you can offer your employees, the more they're going to be happy, the more they're going to be successful, the more your mission is going to be carried out as a company. Retention is much higher. It's almost 50% higher. If an employee feels like they have mental health support at their company, they're going to stay around a 50% chance higher, and they're going to stay for, on average, almost 10 months longer. And so, bringing awareness to that through just your company and talking about it as a beginning is a great start. And I think that it's sort of the norm now. Like, if you don't offer mental health support to your employees, you're sort of behind, especially with what the pandemic has done for mental health awareness.
Yeah, I can piggyback on that. I think it's table stakes to have a robust mental health benefit program as part of your total package. And I totally echo. It's a way to retain your coworkers. It's a way to attract talent in. And in addition, I'm at Boston Beer. We're not only selling our product, we're also producing our product in our production facilities. And having a place where coworkers can go to get support and help them through difficult issues makes those facilities safer, right? So you're going to have less injuries, a more productive environment, and coworkers focused on the right things and the important things on their job, and not have all the ancillary stuff that might put them in danger too.
Absolutely. Thank you, Ryan. And Tracy, I'd like to turn to you to share more.
Sure. I couldn't agree with the panel more. During the pandemic, it's been challenging to cope with remote work challenges, work-life balance, understanding new technology, new safety protocols, transitioning maybe back to work and understanding what the new team dynamic is. And all those contribute stress for all of us. And we really need to meet that moment with our behavioral health supports. Mental health, as I said, is essential not only to emotional and physical health. The panels talked about productivity, job satisfaction, overall resiliency is improved with improved mental health supports. And the data has showed that leads to greater job satisfaction. So I couldn't agree with our panel's points more in this regard.
Absolutely. So Ryan Morin, I'd like to turn to you. It's always good to provide concrete examples for the ways in which employers are really supporting employees and helping to promote their mental health. So can you share a little bit about what Boston Beer Company is doing to protect the mental health of your employees?
Yeah, we've done a couple of things. I think it's perfect that we're having this conversation during Mental Health Awareness Month. At Boston Beer, we actually created a blitz of content for this month, and we branded it "How Are You Really, Really?" So adding that second "really" in place to get past just how are you doing in your day or your week, and how is the just the normal conversation that we typically say, and say, "Oh, I was great," and you kind of get into the day to day. Do that second "really" to really lean in, show empathy and compassion, and get kind of under the hood to see how coworkers are really feeling. So that's been all our branded content this month, which I'm super excited about. We also hosted a call, on Monday that I led a Q&A on reducing stigma. We at Boston Beer want to, make mental health and conversation around, what that is, and having coworkers be comfortable, just like, tearing an ACL or, being sick and talking of mental health in the same way and being comfortable with that. So we talked a lot about stigma with our coworkers and shared stories, which kind of reduces some of those barriers as well. But from a tactical and fundamental perspective, we've also launched a partnership with a company called Modern Health. So there's a lot of great new companies that have started over the last 5 or 10 years to expand mental health access, and we took advantage of that in 2021 to expand our network, get quicker access to care for coworkers. So our coworkers now have access to 8 coaching sessions for free a year, and 6 in-person therapy sessions across the country for both coworkers, spouses, and dependents over the age of 6. So we felt it was really important to not only give expanded access, but free access. So we reduced those barriers to care. So we launched that in November of 2021, which we're really proud about.
Wonderful. Thank you. Tracy, it looks like you were about to.
Yeah, no, I think those innovations and ways people are creatively thinking about addressing the need is really exciting and reassuring as a provider. I know we've talked about over the pandemic, the Blue Cross Blue Shield survey of the first year of the pandemic showed that 1 in 3 adults were needing mental health assistance, either for themselves or for a loved one, which just highlights the need for access. And this system of delivering care that's been developing over decades just couldn't meet the need pre-pandemic. And the pandemic has only exacerbated and highlighted the need for accessibility, the need for creative thinking and solutions. So it's so exciting to hear what folks are doing to promote awareness of offerings that are available for individuals when they need support.
Yeah, for sure. I mean, at Boston Beer, it was really difficult to hear stories of coworkers or their families or their kids not being able to see a provider for 3 and 4 weeks out, right? And with our new partnership, we can get access within a week. And specifically for those children, I think that's been really helpful. I've heard a lot of great stories of I couldn't even find a provider in my area that spoke to children and was able to get it quickly, and then continue to refer into others that might be in network. So I think the scarcity of talent of therapists and psychologists are just so tight right now with the need. It's been really welcome from our coworkers.
Yes. That's really wonderful. And what you just described, Ryan, is very consistent with what we've seen in the recent Blue Cross Blue Shield report, in that in addition to 1 in 3 adults noting that they need mental health care, that less than half were able to get it at the time that they were looking for. And so you're really highlighting the important role that employers can play in helping to gain access to these services through key partnerships with other providers. I'd like to turn to you, Ryan Culkin, if you can share more of the work that you're doing at ThriveWorks to promote awareness among your employees.
For sure. Yeah. So, I mean, obviously, as clinicians, we're supposed to make sure that we're addressing our mental health concerns and just getting support. And so, I think something we implemented this year was our directors meeting with our clinicians at least once a quarter and just saying, "How are you? Where are you at?" Like, rank your burnout to me. Burnout was something that I always did not understand as a clinician, and as a young clinician. It was inevitable. You were going to burn out. And I just didn't like that mindset. And so I think that if you can really attack it at the beginning and talk with someone that is your superior and say, like, I'm burning out right now, or I'm on the fast track to burn out, what changes can we make now? You can really, if you address it sooner than later, you can actually prevent it and maybe not even experience it. And so really talking to their clinicians, how are you doing? Setting things up for them, like safe space, was huge for us. We did that around the time of the death of George Floyd, and that's been overwhelming support for our clinicians, where they can come in and just talk about, whatever it is that's keeping them, that they're experiencing in the counseling office, that's wearing and tearing on them, and they just want to talk about it and feel like they're not going to be judged from anyone, or feel like that's going to be seen as an inadequacy as a clinician or not competent. And so yeah, I think just, talking about, like I said earlier, and like everyone else kind of talked about, how are you doing? Really? I love that. Just addressing it and making your employees feel like it's an okay place to talk about it. As in the past, it's kind of been a hush hush with the stigma and just it being seen as a weakness.
Yeah, I love that you're talking about burnout as well, Ryan. We were talking about that at Boston Beer Company too. And we've been thinking about it not only at the individual level, but at a company-wide level. Is that a company level problem that you can address burnout by how you set expectations about response time and meeting etiquette and, all those team norms and kind of respecting boundaries. So not only at the individual asking how you're doing and where are you on the spectrum of being kind of, needing to take a break, but also addressing it at, other company-wide initiatives that we can do to reduce that overall.
For sure. Absolutely. I love that.
Absolutely. So I'm hearing a few themes already. The first at the top of the list is really efforts to reduce stigma and to really create spaces for normalizing discussions around how you're doing, really. And so that's beautiful. And then also I'm hearing, partnerships to increase access to mental health services. And along those lines, we have a question for our guests. Thank you to our audience who are sharing your questions. To the panel, there's one here that says, we are designing and implementing our mental health wellness strategy and are looking to bring a mental health advocate to help guide and advise our new ways forward. What is the best way to find this kind of partner and advocate? Who would like to take that?
Sure, I can start with that, Nico, from a perspective of a mental health provider. First, I love to hear that there is a identified acknowledgement for the importance of someone in this role, in terms of someone that can be sort of a guide or a gatekeeper and really provide that personal approach to support and meet an individual where they are to help them find the right help when they need it, because we know the landscape of mental health care. When someone needs help, first they're not in the best place, often in crisis, and trying to navigate a really complex system further adds to stress that's already there. So that an advocate can be so very helpful. And I think someone that has an appreciation for the mental health system, the nuances and complications is really helpful, as well as an individual that, you know, has those people skills, those talents for empathy, for listening, for creating that space to allow someone to feel comfortable to speak their needs so that they can be guided.
Yeah, I mean, I'll just add on. I mean, I think don't try to do it alone for sure. I think it's a great idea to have a guide, just like we would have a consultant to help us, you know, implement a medical plan overall, or pharmacy, or any other benefit. You know, reaching out to some of those contacts, whether it's just through your medical plan or maybe a consultant that you have to help build your benefit package, is a great place to start. Or reaching out to, you know, the plethora of great mental health providers, you know, on your own, as doing your own RFP. I'm sure they could give you some guidance on where to go. The other point or tip that I would give you is how we think of wellness or well-being is in kind of 4 segments. We've kind of rounded it out to physical, emotional, financial, and social. So, you know, really make sure that you're looking at all pieces, because it all affects emotional and mental health. You know, how you feel and how you know, are physically is going to affect your mental health. Financial stress can put, you know, in a bad place from a mental health perspective, and socially as well. So, you know, I wouldn't say acutely focus on just one area of well-being, and make sure you round it out and have, you know, different aspects for your coworkers to lean in on.
I was just going to say that if you're looking to find if you're a big company and you're trying to find a provider here, you want to make sure that this mental health advocate you have has done this before, and they can ask the questions that you might not think of. You know, how do they credential their clinicians on the insurance? Do they accept your insurance that you offer as an employer? You know, how do they keep up with demand and availability, right? Is their availability a shared network with other networks, or do they employees that work for that company? How do you present it to your employees? That's huge too, right? Like, you can have this awesome plan, everything, and then how do you get the awareness out, right? And so someone that's done that before is really going to show, like, these are where you're going to get buy-in. This is where you're going to, you know, areas you're going to want to avoid, that can help you navigate that and kind of avoid a flop, basically, which is what you don't want, right? Because then it comes off as the company's all talk, no walk. They didn't do what they said they're going to do, when really that wasn't your intentions at all.
Absolutely. Thank you, Ryan. Ryan Culkin, I'd like to stay with you for a second. There's another question here specifically directed to you. Could you say more about what safe space for employees looks like? Yes, there's a concern that there may be employees may feel that there may be repercussions for speaking openly about their struggles or concerns. So the audience member is asking for you to expound on that.
Yeah, no, it's great. Yeah, like I said, we implemented Safe Space at the time of George Floyd's death, and it was really for our Black therapists to come and talk with someone about the exhaustion that was causing them, and did they feel like they could even be a counselor right now? And we wanted them to feel like they could talk about that, get it out in the air, feel support from one of our clinical directors, and not feel judged. And you know, as a way of extending their competency, because they're able to address this and have support and talk about it with their other colleagues that are probably feeling the same way. And so it's almost like a way of preventing burnout at some point, because these are things that are wearing and tearing on our clinicians, and they don't know where to go, and they don't feel like they can talk about it maybe with their director, because it might be seen as, I'm not able to be a clinician right now, right? But we know that's not the case. Like, it could be the case though if they don't address it, right, and they don't talk about it and get it out there. So I think the way you really do present it to your company is you say, we're starting a safe space event where you can come and talk about anything, and you don't have to be, you know, you're not going to be judged. You're not going to be seen as incompetent. You're not going to be, this isn't going to go on your employee record or anything like that. We just want you to talk about the things that are wearing and tearing you as an employee in your trade. And so for clinicians, that's obviously they're in a counseling room, and maybe their client said something that you know offended them, or maybe something happened like yesterday's awful shooting in Texas. Like, our Texas clinicians might need the Safe Space event right now to talk about this and just feel vulnerable and maybe even emotional about it, where they don't feel like they can obviously do that with their clients or colleagues in a safe manner sometimes. So yeah, I think it's huge. I think it also just sends a great message to your company of, we want you to be vulnerable with us. It's okay. Yeah. And so, I'd love to talk more about it if I need to, or connect one-on-one with this person, but it's definitely something that I think is important to do if you're really looking to support your mental health, but also just the emotional well-being of your employees.
Absolutely. Thank you, Ryan. Continuing with the theme of stigma and how to address it, there's another question here around to the panelists. Can you talk about how does an individual balance stigma around mental health when it comes to work performance and feeling the need to override our mental state of mind so that folks can see them as an asset to the organization? So I think this is more around, how do you lift up? How do you lift up an individual and really, help them to know that they are an asset, even during the times of perhaps burnout or struggles with mental illness?
I can highlight a couple of things that I personally do, or maybe how we think about it at Boston Beer, and then go from there. In regards to just feeling supported and feeling like it's okay, I think as a leader, it's really important that you walk the walk and talk the talk. And it's okay to say, I'm stressed out, I'm burnt out. I said on Monday, I'm taking a wellness day. I'm going to take the day off, and it was kind of unexpected for my team, but I want them to see, that I'm doing it as well. And that's okay, to kind of clear your mind. You don't have to have a vacation planned or be sick to take time off. We're actually thinking about, do we change our, PTO? Do we change PTO to just call it wellness days? Whether you're going on vacation or et cetera, do we just rebrand that so that people feel like it's okay and you don't have to have a purpose necessarily, for that. And, I think as well, with my team personally, I like to focus more on, outcomes versus time on the clock. So, I'm not going to be watching the teams, dot, or Slack or, whatever, chat system you might have at your companies. See, are you on from 9 to 5, right? If you can get it done in 4 hours, or a daycare gets closed, or something else causes stress that you have to step out for a number of hours, like, that's okay, right? Find a work hack to get it done as quickly as you can to get that pressure off and not feel like, I never want my team to feel like I'm monitoring by the minute, and I know that's not the same for every role. That might be different depending on if you're, customer facing or in kind of in a production role versus office or sales. But that's kind of a couple strategies that I've used to break down those barriers and make it feel a little bit okay.
Absolutely. I think it's very important, as you said, that that leadership, it starts with leadership, and to really demonstrate what's possible. And I really appreciate what you've said around wellness days, that you don't have to be sick to take a day off. And it's very consistent with how we have defined mental health at the beginning of this session. Mental health is not the absence of mental illness, right? It's really your ability to take care of yourself. And it's much more holistic. So I appreciate that. Tracy, it looks like you were about to say something. Did I interpret that correctly?
I just get, as a psychiatrist, excited about talking about the concept of wellness days. We have a lot of internal conversations in my group about that, as well as modeling that behavior, that flexibility of, meeting the moment in terms of, people, if they need to shift an hour for daycare or pickup. And really our professionalism has evolved to meet this behavioral health moment of crisis. And it's really refreshing to hear. Sometimes in our meetings with other psychiatrists, we talk about, and we're still in a pandemic. We've really gotten good at coping to the best of our abilities, but sort of level setting that this is still hard. This is still different. And any way we can get that message out there to foster a space for discussion, for support is fundamental.
Absolutely. Absolutely. Thank you, Tracy.
Yeah.
I'd like to stay with you for a moment as I'm looking at some of the questions that have come through. There is a specific question, if we can go back to partnerships. It reads here, as it's difficult for employees to gain access to mental health professionals, would insurance companies allow providers to be out of state since it's for telehealth? So Tracy, I'd like to just turn to you and see your thoughts there.
Yes, no, I think a silver lining in this pandemic is how we all understand mental health is universal, and there have been, emergency measures through the pandemic so that mental health care has been mental health care. And during lockdown, that we had telephone appointments equaled a telepsych appointment equaled an in-person appointment. So the way we look at care has shifted, and we talk about these creative solutions and different offerings employers are bringing to individuals who work there is really so important. And health plans, I know, are looking at innovative solutions to address this need of access, and how do we bring the right care when the individual needs it. So absolutely, I think people are still looking at what care looks like and are working to break down barriers.
Absolutely. Thank you for that.
Sure.
Okay, we have a few more questions. Thank you, audience members, for lifting up your questions for the panelists. There's one question here around the virtual environment and the hybrid working environment. How important is a healthy office culture to health, and how important is a healthy office culture to health and wellness? I think you've stated some of your responses there, but if someone could share a little bit more of your perspective, that would be great. How can employers recover culture? How can employers really foster a culture of health and wellness in a remote working environment? What are your thoughts there? We've been in the pandemic for quite some years now. And so, yes, would love to hear your thoughts.
I can talk there to that. We started off as like basically 97% of our clinicians were in person, and they all had to switch overnight in March during the pandemic to remote. And so that was tough for us as a company too. Like, how do we foster our one of our core values is teamwork, and really that belonging and the lack of loneliness that you might feel if you were in your own private practice. You had at ThriveWorks. And so, we've done things like Workplace by Facebook. It's like a social media platform for employees. That's been great. You can have all types of different walls, and they can post their pets and their families and just talk amongst each other. And also kind of trying to think what do we do in the office and how can we do it online? And so we used to do monthly, coffee hours where they come together and just talk. And so we're just okay, let's do that the same way, but remotely, and see if we can, we tried some things like getting them Uber gift cards and, have that coffee hour still together and make sure that water cooler talk is still happening. Because if it doesn't, I think that a lot of people, especially your extroverts, are they are going to burn out, or they're going to find somewhere else that does fill that need of I need to collaborate with others. So that's been, it's still tough. I think it's still tougher from a remote aspect, but there are ways to do it. And I definitely, love to hear what other panelists have done within their remote culture.
Yeah, I mean, it's difficult. I can share Boston Beer, where we're at and what we've done to date and where we're going to continue to go. So we were very much an in-person environment 2 years ago, to the point where we were rehabbing our office and they moved us down a floor on bench seating, with hundreds of us, because we couldn't possibly think about working remotely. And then literally, we moved back to the office and it was closed a month after we rebuilt it. And so it's just kind of funny looking back at that. We paid for extra rental space because we couldn't, possibly think about being a remote organization. But we're very very much an in-person environment. We're very, collaborative, every division, so to speak, is in the Boston area, to collaborate with. So it was a big hub where people would get together and gather. We have, a lot of celebrations that we try to do. We are a beer company, so we try to be, fun and inviting, and we're trying to, you can't recreate that virtually, we found, and it becomes very transactional in how you interact with people. So, like Ryan said, trying to replicate that water cooler talk. And what we've learned to do or tried to do is try to make people's trip to the office or going into the office purposeful. So don't have set days, but be flexible on when that is, and plan your meetings and times and gatherings around time you would go in, so that it is meaningful. Like if you're, we say to our coworkers, if you're, on Teams meetings or Zoom meetings 100% of the day in the office, you probably didn't, crush that day. That's not how you wanted to, spend an hour and a half commuting in. I live in south of the city, so I live in Bridgewater, so I had to commute an hour and a half in. I sat on Teams all day. I could have done that at home, right? But if I have meetings, we have a gathering, we have other, we have a well-being vendor day coming in tomorrow, actually. So another reason for coworkers to come in, meet our vendors in person, kind of like a mini health fair too, just to kind of get the word out and find different reasons, for coworkers to get together.
Absolutely. Thank you. Tracy, can you share some of your thoughts there on what you're doing at Blue Cross Blue Shield?
Yeah, absolutely. And I think one thing that's been really helpful, like our panelists have said, is trying to simulate that the social connectedness that can be challenging when we work remotely. We have some standing meetings daily where we all just check in. We talk about if we have some challenging piece of work or what else is going on. Again, more reminders, we are still in a pandemic and we're working very differently in how are people feeling, and that time is there. We know it's there if we need it, which is really helpful. And I think providers are really shifting the way that they work. In my work, I'm practicing very differently than the traditional hospital office model that I was trained in. I started doing telepsychiatry pre-pandemic, so was aware of that need to really advocate to know the system, not feel isolated, and that is very true. I also work consulting with the MCPAP, consulting with pediatricians in Massachusetts to help them meet the behavioral needs of their patients, which have been overwhelming. And as we talked about, I work within a health plan. And I think having those areas where there is social opportunity for support is so important. We've had, coffee hour, virtual sessions in one place of work, office hours, just different opportunities that are there if people want to connect can be really helpful.
That's great. Thank you, Tracy.
Sure.
Building on this theme of social connectedness, and apologies, I think my video is frozen at this time, but you can still hear me, correct? Yes, okay, wonderful. So yes, building on the theme of social connectedness, there is a question related to what the office can do, what can employers do to really foster joy and creativity. So, there's another question that I think is also related. They're looking for your thoughts as a panel on how do you do that in a group setting? So how do you go beyond, individual sort of treatment or giving access to individual treatment and really continuing to build this sort of culture of normalizing mental health supports?
Well, I think it's beyond mental health support. Maybe it goes to that social bucket of well-being that I was talking about. And I think one way to get people excited and engaged to come in and share stories is sharing wins, right? And wins could be small or they could be big. We have a social recognition platform at Boston Beer that we launched a couple of years ago that people can, say thanks for cross-functional work, and they can recognize wins. But you can do that, individually. You can do that in a group town hall setting. But I think, all of that, we love, seeing successes. You don't always hear all the successes when you're just working with Aniqua or Tracy, or you're working on your own work. You might not see what brand is doing or production if they, work through a challenging issue. So you get that more in the office, right? You don't get those high fives. So it's nice seeing that and trying to replicate that. And we're trying to actually amplify that a little bit more through this year, just to kind of show, the work that teams are doing across the company.
Absolutely. Thank you, Ryan. Ryan Culkin or Tracy, do you have thoughts there? Okay.
From a remote standpoint or in person?
From remote standpoint. Actually,
Yeah.
either. Could be remote or in person, yes.
Yeah, I think something that I've noticed that one of our departments does is they work together online often. So maybe they just are doing their own task, but they just go into a chat room and they work together and they talk while they're working, even though they might, it's not a meeting and it's not that they're working on the same thing. It's just, hey, look, it's almost like if we were sitting in a cubicle together and we all saw each other and we're working. And so I love that. Because it does fulfill like that social aspect and of talking and how was your weekend, how the kids doing. And I think that, some people don't need that, but a lot of people do. And so the more we can foster that, the better that, people are going to stay around and feel like they're doing something that's sustainable.
Mm-hmm. Absolutely.
Yeah, I agree. Fostering that social connectedness and being mindful of that is so important. I know I work with some providers that, leave their camera on that are doing telepsych during lunch so that, if anyone's around, they can come and hang out, ask a question, just to kind of simulate being in an environment that's open to those relationships that we miss when we're not working together.
Absolutely. Thank you for that. Recognizing that, you all as panelists have really shared what employers can do. And you've given wonderful examples, a plethora of examples of how employers can really foster social connections, promote mental health within their walls. And we heard from the data that you've highlighted, Tracy, that this is a need, a pressing need, particularly given the context that we are all navigating with the pandemic and the traumatic instances that are occurring almost on a very frequent basis. I'm curious, though. I know that there may be some employers that there's a spectrum. There may be some employers that have that this may be newer. For them and really embarking on efforts to embed these types of activities and plans in their work. So I'd like to ask each of you if you can share, what is the business case? If you can just share one or two high-level points of what is the business case for really taking that step, taking that plunge forward, and really taking a deeper dive and supporting your employers in this way. Why should other businesses, really take the lead on doing this work as you have done?
I mean, I could start with, I connected with our director of external partnerships this morning, and he said, like I said earlier, if you're going to retain about 50% more of your employees, and they're going to be about 53% more productive. And so, I mean, that to me is a huge business case of why you want to focus on this. Love to, I don't know what everyone else is seeing.
I mean, my 2 cents is you're going to spend the dollars anyways, right? And you're either going to spend it through the medical plan, or you could be more targeted and offer something more robust and wide for your coworkers to get and have it for free, right? As an extra carrot to the point on retention. So, I always think of these and position these to our C-suite as a rebranding and repurposing of dollars, not asking for new dollars, right? And you're going to get that, in some of the retention numbers, hopefully. I think we're all seeing higher, so it's hard to make that argument right now. You're saying, well, we're not as bad as some other companies that might be out there, right? It's still worse than we once were, for sure, with where we are right now with the tight labor market. But just even showing we're transitioning dollars that may have come through the medical plan to a PEPM model that we know that what that fixed cost is, and we want to really lean in on it. And I think it just shows who the company that you want to be, right? And how you want to take care of your coworkers, right? It says a lot about a company to say you get 6, free therapy sessions for you, your spouse, anyone in your household over the age of 6, and stop. No questions asked. So I think you get that other goodwill as well that doesn't show maybe in some of the hard numbers.
Yeah, I think having that information out there, people having awareness that those offerings are there if they need to, is very powerful and can be just therapeutic in itself. If I need help in this trying time, I know I can have it and work for this great company where there's a positive culture. We want to invest in our health of individuals within the organization, and mental health care is healthcare. So it just makes sense to make sure that we're taking care of our employees in that way.
Mm-hmm. Absolutely. Thank you, Tracy. I'd like to stay with you for a moment. The report that you've referenced that Blue Cross Blue Shield recently put out also highlighted some of the disproportionate burden of mental illness and the need for mental health care for certain demographics, certain employees, younger employees between the ages of, I believe it was 19 to 39, definitely highlighted a greater need. And we also saw disparities, if you will, when you broke up the data by race and ethnicity. And so I'm curious, from your perspective, what are some things that can be done to really support and address the disproportionate burden that you're seeing?
Yeah, I think your point is so well taken that the level of need has been disproportionate. We have seen a particularly vulnerable population to be younger adults, as you said, folks that identify as other than non-Hispanic white, among adults with lower family incomes. National trends have also mirrored what the Blue Cross survey found in Massachusetts. The CDC has been doing surveys over the course of the pandemic and has found that 40% of adults have identified a mental health need. And what we're seeing are really high incidences of anxiety, depression, trauma and stress-related symptoms, as well as substance use disorder. So I think having insight into these are the major presentations that we're seeing amongst this vulnerable population, and having offerings for support. Particularly vulnerable we've seen our caregivers, adult non-paid caregivers. And too often during the pandemic, many people have fallen into this role on a dime, needing to care for a loved one, as well as try to maintain a professional life. So these folks are very vulnerable to struggling more with mental health challenges. And I think recognizing that and making sure employers are overtly and actively promoting different supports they have. As I say, just knowing that they are there can be very therapeutic for people to know there is help out there for whatever I'm going through. I just need to reach out for help if and when I need it.
Thank you. Thank you. I'm looking to Ryan Culkin and also Ryan Moore, and if you'd like to share any specific things that you're currently doing. I know, Ryan, you shared a great example of what you've done following the unfortunate murder of George Floyd at ThriveWorks, but just curious if you have additional perspective that you would like to share.
Yeah, I think just learning the needs of your employees is a big start. Not having a one size fits all wellness and mental health support platform. When the pandemic hit and our kids all went home, a lot of our working moms were like, I can't work like I used to work, or I can't work the schedule that we had. And we didn't want to lose these great therapists. So it was like, what will work for you? If you have to work on the hour, off the hour, or work 1 hour in the morning and 1 hour at night, to get you through this time, we're willing to work with you there because you're a great therapist. We want to keep you. And so just partnering with them. If, we've noticed that sometimes our younger therapists need more support, better training, different types of training, right? And so like just hearing and surveying and finding out what is it that you need to feel successful here and to feel supported here, and moving from that feedback and really responding and finding a way to really not put it into a one size fits all, because it won't work. There's just so many things that come into play when it comes to what's wearing and tearing on the mental health or the wellness of your employees.
Thank you. There's another question here that is very much builds upon what we're discussing. What about the mental health and wellness of new and expecting mothers and fathers? Are there policies that correlate to family leave policies correlate to mental health is the question.
I mean, I can take a stab at that, and I'm lucky enough to have a team of 5 incredibly strong women on my entire. So my team is entire women and myself on the team, and 4 out of the 5 have children under 4, like myself, and so I see the daily stress that planning home life places on them, more so than probably I have in my home life, and and above and beyond the pressures of work. So I definitely appreciate the question and incredibly sensitive to it, just because I see it daily within my team, not just the company. But I think having a really robust maternity and parental leave is helpful to for expecting parents and not only just birth parents but non-birth parents as well. Having a really strong program so that people can feel like they can take the time and they are getting compensated for the time that they're away, and they can really disconnect and say, okay, I don't have to come back after 4 weeks or 6 weeks. It can be the 10 to 12. And I know in Massachusetts we have a robust state leave. So everyone on this call has a very lengthy leave that people can take advantage of. So I think that's one really important part. And I think also having some networks that help working families for people transitioning back. That's a really difficult time. I know it was difficult for my family when we had our first child coming back after 12 weeks to come back in, and what does that look like, and how do I deal with the stress of getting to daycare and commuting, and that's a big change in your life. You thought you had so much time until you have a kid, and then you realize you had you had no time. Now you realize all the time that you had that you wasted and you didn't take advantage of. So I think helping people transition back and getting back in the swing of things of work and having a resource to lean on and not going alone is really important.
Thank you.
I think also just framing that time, right? So obviously over 80% of our clinicians are females, and a lot of them have come up to be directors, and they're overachievers, and so that you can feel the stress that they're having, saying I'm going to be out for 12 weeks, and just reaffirming like it's going to be okay, like we have your back, I'm not going to reach out to you. If you have questions, feel free to reach out to me, but just making them feel like it's going to be all right. We have your back, and whatever happens and whatever you need, just ask, right? And feel safe there. I just think a lot of times it's just, they put the stress that a mom might put on themselves of, I'm going to be out for 12 weeks. I'm sure, like, if I felt like I was going to be out for 12 weeks, I'd be like, oh my gosh, I'm going to get so behind. And just making them feel like that's not the case, and that we're going to set your region or your site up for success, or your clients up for success, and just enjoy this time with your family.
Thank you. Tracy? Yes.
Yeah, I think that's such a lovely message. We know that there are gender disparities, increased incidence of anxiety and depression amongst women, amongst caregivers. And it has been a challenge transitioning back to what work looks like now for anybody. And for our caregivers that so often don't take time for self-care, there are so many facets in our life that people need to be vigilant for, safety protocols, et cetera, that we're finding, caregivers often aren't taking the time they need for self-care. So the fact that there's that conversation is wonderful and is going to promote wellness.
Absolutely. Absolutely. I want to be mindful of time. I cannot believe we're already at 10:55. And so I want to thank all of you as panelists for providing your insights, Tracy, Ryan Morin, and Ryan Culkin. I'd like to, before we close, end with one question. In your opinion, what is, and this is going to look at, the question is going to reference both an individual level and the organizational level. So if you can share, what is one thing individuals, our audience members can do today to protect and promote their mental health, as well as what can employers do? If you have one piece of advice that employers can do today to protect their employees' health, that'd be great.
From an individual perspective, take time off for yourself. We have too many people that don't take the time that we award them and in PTO as a benefit, and that leads to burnout, that leads to more stress, so and actually less productivity. So I would say individually, take the time, take your wellness days, don't call them PTO days or vacation days. And I think as a company, just making it as simple as possible that coworkers can access the resources, whether that's via an internet, via good communications, whether that's email, et cetera, being big promoters and making it okay to take time for yourself, and whether that's a coaching session up to therapy, just taking the time for yourself and doing it during the workday and carving out time and making it okay to carve out during the workday. You don't have to do it on the weekend or at 8 o'clock at night or early in the morning. It can be at 1 o'clock. That's okay, and saying that's okay. So those are my two.
Thank you. Tracy or Ryan?
So I mean, for individual, I would say Tracy referenced to self-care. I mean, that's so important, and that's different for everyone, right? That doesn't mean, working out for everyone, or it could be self-care of being around with your friends. Just making sure that you set up great systems in place and accountability to ensure that whatever you call self-care, and that is that's what recharges your batteries, happens more often than not. Because then we all know when we get 2 weeks, 3 weeks down the road, we just feel awful and we feel like we're down, and we also feel bad that we missed those 3 weeks. And so just setting up good accountability there is going to be huge, and whatever that is. And then for companies, I think just getting rid of the stigma, continuing to do that. It's been, for so long as unprofessional to talk about your mental health with your colleagues or your directors. And I think when you think about when an employee does that, sort of what's that, it's inferring that you have great trust with your employees, you have a great relationship with your employees. And the more you can have that amongst your company, the more you're going to reach your mission. And so just, I just can't help make it feel safe as much as you can. And obviously that's going to come through actions. It's going to come through what we talked about earlier of taking time off. Our CEO, Will, has been awesome with make sure you use all your PTO. And then, and it goes down, and I talk to my directors, are we sending emails to our clinicians at 9:30 at night, right? That's just it's not, lead by example. And I think that they're going to start to feel that, and then they're going to start to talk to you about it. Hey, I've been struggling here. Awesome. Let's talk about that. You're not showing me the weakness. You're not crossing boundaries. You're trusting me as a colleague or as a leader, and let's get through this together.
Absolutely. Thank you, Ryan. Tracy?
Sure. I agree with my fellow panelists. I think making efforts to connect with those that perhaps are having challenges, I think letting them know you're there for them, creating a space that they can use if they need it, and having empathy and listening will go a long way. And I think for our own self-care, those kind of fundamentals that we know, but we take for granted and kind of forget about them during times of stress, that, what's going to keep us well is consistent, structured sleep, good nutrition, good hydration, trying to get some activity if you're working, especially from home, trying to take a little time for that. Building in those activities that work for you to relax during the day and not having them to be add-ons, at either end of the workday. Can be really helpful. And just trying to remember what's fundamental to our physical health is also fundamental to our emotional health.
That's a beautiful way to end. What is fundamental to our physical health is also important for our emotional health. Thank you, panelists. Thank you all for sharing your insights. To our incredible audience members, thank you for joining us. Thank you to the Greater Boston Chamber of Commerce for hosting this conversation, and to Blue Cross Blue Shield Massachusetts for your sponsorship of this important program. To close, I'm hearing a few themes of what you can do today. At an individual level, it's about taking time for self-care, taking wellness days if you can. Also, employers can do the work to address stigma and really help to normalize conversations, increase access to mental health support services. And I would also just add to develop an understanding of the inequities that exist in mental health, and really addressing the issues in a way that really speaks to the diversity of the employees that are within the organization. So thank you all for your time, and please note that tomorrow on the 26th, the Chamber is hosting a government affairs forum, and the forum will feature the speaker, Ron Mariano. So please join, go to the Boston Chamber's website, bostonchamber.com, to get more information. Once again, thank you all for joining us. Thank you.